Well, let's talk about the types of augmentation you can have, because there is silicone, there is saline, there are different sizes. How does that all work?
Well, the silicone breast implant is the most common way of augmenting a breast. And the FDA finally approved these in 2007 for cosmetic purposes. The new silicone implants are safer than they were, say, back in the 80s when the shells were very thin and the gel was actually more liquid. Those implants would rupture. Nowadays, the implants are actually have a thicker shell and the gel is more cohesive. So these don't leak as much or as readily as the older implants. And the FDA recommends that after 3 years that the patients start doing MRIs every 2 years, because the breast is not going to deflate. And really that's the best way of determining the leakage. And it tends to be a favorite amongst patients. They feel that it feels a little more natural, and we've been using these for breast reconstruction all along, even during the moratorium that started in the 1990s. So the silicone breast implant is now the most common implant that we use nowadays. But your alternative is a saline implant, which is the silicone shell, but then once we put it in the body, we fill it up with salt water, so it looks very much like a silicone implant.
Just more hard.
Well, some have told me it feels like a water balloon. Some think that it feels very similar to the silicone implants. But when these fail, these deflate, come back to this, and then we know that it's deflated because the breast is smaller.
And you're saying with as strong as they are, typically it's not like they pop, it's more that it's just over time they get a crease and then they rub and then they just get a small hole or a thinning.
Yeah, there's a thinning in the shell.